Almost all cases of heart disease have risk factors you can address before getting sick.
For more on that, we're joined by cardiologist and 9 News medical expert, Dr. Payal Kohli. Heart disease, and of course, you being a cardiologist, this is your expertise. #1 killer. Does it always come with a warning?
You know, I have patients in my office every single day. They say to me, "Oh, Dr. Kohli, I had no idea this was going to happen." So this type of research is really important. And what this study did, it looked at over 600,000 cases of heart disease, heart failure, and stroke. 99% of them had a risk factor that was suboptimal, that wasn't well controlled. And if you look at a broader sort of American perspective out there, 90% of Americans have one or more risk factors for cardiovascular disease. So it's the most likely thing that's going to happen to us, but it's something that we have such a hard time wrapping our heads around that we don't somehow get ahead of treating the risk factors. And that includes physicians as well, because things squeak by without us noticing.
What's the most common non-optimal factor that you see?
So in this particular study, it was blood pressure. And most people think that a blood pressure greater than, 120 is okay. So people tell me my blood pressure is 125 over 82. That's high. You want to be less than 120 over less than 80. So if you're already crossing over into that 120 range, that's called prehypertension or elevated blood pressure. That's already suboptimal controlled. And if you think about how our blood vessels age, they get stiffer. Just like our skin gets wrinkles, our blood vessels get stiffer. So the natural history of our blood pressure over time is that it goes up. And I know we just talked about menopause, but menopause is a big trigger for women to start to change their blood vessel because it changes the tone of their blood vessels as well. So the blood pressure can go up after menopause. And that's not something that we usually know. It just kind of sneaks up on us.
Yeah, and I feel like, unfortunately, there's not a lot of information that we know. It's important to go to your doctors so you can stay ahead of it. But according to you, what would be the most difficult part of heart disease to treat and detect?
It's so abstract, right? Like you're both sitting in front of me today. I'm telling you it's the most likely thing that's going to happen to you, but you probably have no concept of your individual risk, right? And it's not something that causes symptoms. If you think about palpitations or leg swelling or back pain or knee pain, urinary infections, those all cause symptoms. So we know what we have to fix. We take the medicine, we fix it. With heart disease, it's all these nebulous risk factors that most of us are going to get that sneak up on us, and then we don't really realize and treat them in time. So I think the abstract nature of heart disease makes it one of those things that makes it extremely difficult to diagnose unless you're proactive and screen for it. And most of us feel good every day, so we don't think about screening for heart disease. And in our 30s and 40s, we don't think we're going to drop dead from heart disease. So it's not top of mind at all.
That's alarming. I've never even thought about that.
Have you thought about your risk?
No, I've never once gotten my heart checked.
I'm like, my blood pressure's always good, so I'm like, I'm
Yeah, me
good.
too, yeah.
I don't need to do anything beyond that, right?
But there are 8 different factors, ladies. And so I want us to go home today and calculate something called Life's Essential 8. It's the American Heart Association website, has the score. And it tells you what you're doing well and what you're not doing. And it includes lifestyle factors as well as things like blood pressure, cholesterol, our weight, whether we smoke, how much sleep we're getting, how much exercise we're getting, kind of gives you a little bit of a prescription for heart disease. And I find with patients in my office, it's often very difficult to convince them to treat their cholesterol or treat something that's not causing symptoms, because the idea of a medication many people attach to aging. They say, I don't want to be on a medicine for the rest of my life.
Or they need to have like a real active physical symptom, right?
Yes. And they say, well, I don't need this medicine, or I don't want a crutch. I don't want to be on a medicine for the rest of my life. Medicines aren't aging. Not taking medicines is causing aging. So I really want us to change the conversation around medications, because we know that 80% of heart attacks and strokes are preventable. By taking those right medicines in your 30s, 40s, and 50s, you're going to prevent yourself from having a stroke in your 60s, 70s, and 80s. So think about it like it's going to make you live better, longer. It's health span rather than just lifespan, and really change that narrative and say, hey, I'm getting ahead of the disease and I'm being smarter than it.
Yeah, I like the way you put
Me
that.
too.
Yeah.
Makes me want to do my homework.
So
Dr.
Life's
Kohli.
Essential 8, calcium score, which is an x-ray of your heart, and then some blood tests, and report back to me.
Oh,
Will do. Homework. We got the homework. Dr. Kohli, thank you. You can find more with Dr. Kohli always on 9news.com/Dr. Kohli.